ashver.com.
Hello and welcome to ashver.com. You are watching an interesting video on how to pop a dental abscess by yourself. Use every resource you have.
Please read the disclaimer carefully.
At this moment in time, I feel it's safe to say that if you're reading this video, you understand exactly what it's like to be put through the pain of an abscess in your mouth. Even if you're lucky enough to only experience pain on the mild end of the scale, that can be bad enough. Many people, myself included, have experienced abscess that literally take your breath away, make your heart race and put thoughts in your head that you would never normally entertain. One of those thoughts is likely to be, can I just pop the damn thing? The answer is yes, you can. Though before we go into how to do that, I want to make it clear to you right now that I, the author of this hub, am not a dentist, nor do I have any specific affiliations with any thieving dental agencies, groups or insurance companies. I am simply someone who was unfortunate luck of being born with a predisposition towards early tooth decay. What that means is that I've had plenty of teeth infections, abscesses, extractions and painful dental conditions. So while I may not be a trained medical professional, I am certainly not ignorant to the health issues, pain factors and safety concerns of oral health. I've also had plenty of opportunities to explore home remedies, one of which is popping or lancing an oral or dental abscess. Consider this. While it may seem like little could go wrong when lancing an abscess, you need to be aware that assumptions just like this one are what get people into serious trouble, especially when it comes to abscesses in the mouth. Popping your abscess will definitely bring you instant relief, in case you were wondering, but it can also bring on a whole new set of problems if you're not careful. The highest risk is of getting an even nastier infection in your mouth, and the most common way of causing that is by lancing your abscess with an unsterile instrument, throwing up after it's burst, or by not thoroughly cleaning your mouth after the abscess is drained. The next most common negative consequence can come when you swallow any of the pus, blood or other fluids that can come out of your abscess. This is all the stuff your body specifically trapped, which is why the abscess formed, and the point behind that is that you don't need any of that in your digestive system or bloodstream. Even a small amount of pus down the hatch can spell big trouble if the infection was bad enough. Your risk to this increases if your oral hygiene or dietary habits are lacking, and decreases if you're otherwise pretty healthy. Another common challenge is when you lance an abscess that was not quite ready to be lanced. In a similar fashion to fruit, abscesses have a way of ripening and preparing themselves to be burst. In fact, if you did nothing, the abscess would basically swell until it burst. This is actually not a problem health-wise, so long as the abscess is not anywhere near your neck or throat. If it is, then any swelling becomes a danger, because it can block your airways or lead to serious heart problems. In fact, if your abscess is along your lower jawline and is swelling or pretty large, go to a hospital now for 4 antibiotics and a professional lancing before that abscess does you in. They can be that serious. Doctors and dentists would prefer you err on the side of paranoia and caution than to try and wait. All that being said, if you lance an abscess before it was ready to be popped, it can be much more painful than it should be, and it might not even truly drain. On top of that, you could easily introduce a completely different set of bacteria into the one abscess and give yourself all sorts of new problems. There are several important veins in your mouth and around your gums as well, which dentists are trained to avoid. You're really not going to know where they are, even if you do a quick Google anatomy lesson, which means you run the risk of poking a vein and bleeding a lot more than is necessary. If you're taking any anti-inflammatories or blood thinners, this could mean a trip to the urgent care. All of the above and more can happen when you decide to play dental doctor on yourself. Sometimes it's worth it and sometimes it's not. This is why I bring up these issues, and it's also why you need to seriously consider them before you go searching through the house for the smallest sharp instrument you can find. You'll also want to consider that while you may get immediate relief from the pressure and pain of an abscess, you'll still have the pain of the wound and a source of open infection in your mouth. If you don't find the source of the abscess, which is most likely a tooth, then you're going to just keep getting abscesses that will get worse and worse. What this means is that you still need to see a dentist as soon as possible. Trust me, I don't enjoy the idea any more than you do, but it's necessary if you don't want to be doing this again and again. And you can easily look at it this way: avoiding the dentist now means even more dental visits later. It could also equate to plenty of visits to your general practitioner or an oral surgeon, which can mean spending a lot more money than the $300 it would cost you for a visit to the dentist. Not to mention, if you're seeking free dental care, you're going to find there is less and less care the worse your condition is. So go and get your mouth taken care of right away and don't wait for the pain or the abscess to get worse. Use every resource you have. Before you get ready to dig in, do everything you can to learn about your mouth, your health, and the art of popping that sucker just right. Ask your mother, call your neighbor, talk to your vet, and hey, why not call a local dentist? Most of them are nice enough to explain the best way to lance that abscess, and then you can make an appointment to get checked out after that. You need some things before you start. A needle or small sharp instrument, for lancing hydrogen peroxide, preferably food-grade clove oil, a numbing agent sea salt, as a mouthwash. Instructions: get out a pot and boil some water to sterilize your needle or other sharp instrument. While you wait, apply a generous amount of clove oil to the area around your abscess to numb it before you go in there. Once your water is boiling, drop in the needle or instrument and allow it to boil for at least 2 minutes. You might consider holding it in the water with a pair of tongs so that you don't have to fish it out into a strainer later. Once you're done, place the needle on a very clean plate and make sure not to touch it until you're ready to use it. Go into the bathroom or use a sink that is easy to bend over. Make sure you have some washcloths and a glass of cool water nearby. Take your hydrogen peroxide and pour 2 caps of it into a small glass, not the one with your clean water, and dilute it with 3 times as much water. This is very important. Wash your hands. Do it the way a nurse does and soap up your hands while singing Twinkle Twinkle Little Star. Then rinse and wash your hands one more time the same way. Trust me, you won't regret taking this precaution. Once you're done washing your hands, brush your teeth as well as you can with just water, no toothpaste. Then gargle with a glass of heavily salted water. Remember that it has to be sea salt. If you have or can get some latex gloves, get them and wear them before starting. Next, prepare to pop that abscess. Make sure to get yourself mentally ready, as it will take some willpower to poke yourself in the gums and it's going to taste really bad. That being said, you'll also relieve the pressure and make it easier for your dentist to pull that tooth or do that root canal for you when you see them. So get your needle or sharp instrument out. Try to get your hand and your fingers comfortable in your mouth where you can lance the abscess with a decent amount of force. You don't want to jab the needle in, but some abscesses are thicker than. Being as careful as you can be, you want to force the needle into the sac of the abscess at its tightest or softest point. You have 2 choices with this: slow and deliberate or the just get it over with jab. The first method is where you slowly insert the needle into the abscess until it pops. It can be bit more painful because it takes longer, but you are also less likely to go deeper than necessary. With the second method, you want to think about how you would quickly pull off a band-aid instead of slowly peeling it off. With a well-aimed poke of decent force, it doesn't take a lot. That abscess will be draining faster than you think. Be prepared to quickly pull your hand from your mouth and get rid of that needle onto its clean plate. If your abscess was ready to give way, you'll have no problem just leaning over the sink and letting it drain itself silly, at which point you might pass out of ecstasy. If that bugger is more stubborn, You'll want to massage or cheat the abscess or use your fingers to apply pressure inside your mouth near the back of the abscess. Do this until no more pus, blood or liquid comes out, and then do it a little bit more in just. Once you're done, take your mixture of hydrogen peroxide and water, and swish it gently around your mouth. Make sure you spit it all out and then gargle and spit with clean water to make sure you get everything out of there. Keep your mouth as clean as possible for the next 24 hours especially. Avoid eating much and stick to water only for a beverage. If you must eat, go with soft foods and keep it on the opposite side of the abscess. How to pop an oral abscess, drawing out the poison. This is an alternative method that doesn't require any poking. Simply get some sea salt, very specific, and baking soda. Mix the two together in a bowl with a little bit of water until you have a very thick wet paste. Take that paste and plaster it onto your gums where the abscess is and wait near a sink with a towel handy. It shouldn't take long for your abscess to burst if it's ready to, and you'll want to be ready to spit and rinse very quickly when it happens. Basically, follow steps 10 and 11 from above. How to pop an oral abscess, the tea bag method. Another alternative method is to get yourself a tea bag. You want it to be either black tea, green tea or echinacea tea. Take the tea bag and dip it in lukewarm water until it's soft, then place that tea bag along the gum line near your abscess. Traditionally this done overnight, while sleeping on top of a drool cloth and near a bucket, though you can also do this during the day, as long as you keep the tea bag in. The tea works to draw out the poison in the same way that the salt and baking soda trick does, which means that it will pull the poison up and then burst the abscess to relieve the pressure. After it bursts, make sure you thoroughly clean your mouth and throw away that infection-filled tea bag. No substitutes for a good dentist. I've had my fair share of experiences with dentists, and there's definitely a pattern amongst the DDS in the world of sliding scale and community dentistry. They're often surly, tired and underpaid. That being said, they know a heck of a lot more about what they are doing than you do, and more to the point, they have all the tools for the job. Dentists in traditional clinics are often paid more and have a better attitude, though we all know that a strong bedside manner comes with a big price. You take what you can get in this case, and what you can afford. Just keep in mind that what you cannot afford is to lose your job or your life before you time because of a fear of the dentist, pain, embarrassment or losing teeth. Get it done and over with now and avoid a future mouth of pain. There's just no good substitute for a good dentist yet. There are plenty of ways you can increase your health and avoid future dental visits by permanent changes in your diet, exercise and emotional habits, but once you've already got pain, abscesses or dying teeth, the dentist will be your only.
Thank you for watching this interesting and informative video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find a lot of interesting videos on wide range of topics here. Stay tuned and keep watching.